you know today is a very special day? Yes, it is, because November 7th is dedicated as National Cancer Awareness Day. Hi, I'm Dr. Rani Bhatt, gynecologist and an oncologist at Apollo Hospitals, Bangalore. To highlight the significance of increased awareness about cancer prevention and early detection among general public, the National Cancer Awareness Day is observed today. The government had initiated the National Cancer Control Program way back in 1975 with a view to provide cancer treatment facility in the country. And in 1984-85 was given the thrust on prevention and early detection of the disease. This day coincides with the birth anniversary of eminent French-Polish scientist Madame Curie, winner of the 1903 Nobel Prize in Physics. Curie is known for her discovery of radium and polonium and her huge contribution to the fight against cancer. Her groundbreaking work led to the development of nuclear energy and radiotherapy for the treatment of cancer. In 2014, Union Health Minister Dr. Harshvardhan had first announced the National Cancer Awareness Day with an aim to generate awareness on early detection and avoid cancer-causing lifestyle. In India, nearly 1.1 million new cases of cancers are being reported annually. 2/3 of cancer cases are diagnosed at an advanced stage, reducing patients' chance of survival. It is estimated that one woman dies of cervical cancer every 8 minutes in India. It is known that if detected early, cancer can be treated at a fraction of a cost that is incurred when diagnosed at an advanced stage. Its mortality rate is also lowered substantially if people report for screening when the earliest symptoms are manifested. Today, I want to talk to you about two important lifestyle factors that are known to cause cancer, that is tobacco and alcohol. Tobacco, smoked or smokeless use, accounted for approximately 3,17,928 deaths both in men and women. Cancer of oral cavity and lungs account for over 25% of cancer deaths in males, and cancer of breast and oral cavity account for 25% of cancer in females. A Lancet Oncology journal, which is a very reputed medical journal, it reveals that use of tobacco is a risk factor for 16 types of cancer. 16 types of cancer. Namely, when we go from head down, we have paranasal sinus and the nasal cavity, oral cavity, mouth, including lips and tongue, larynx, that's our voice box, pharynx, that's our throat, esophagus, our food pipe, lung, liver, pancreas, kidney, stomach, myeloid leukemia, which is a type of a bone marrow cancer, colorectal, what we call it as a bowel cancer, bladder, ureter, ovary, and cervix. So imagine one tobacco causes 16 types of cancers. Now coming to second-hand smoke, what we generally say, passive smoking. Is there any risk of passive smoking? Since 2004, International Agency for Research has stated that there is evidence sufficient to conclude that involuntary smoking is cause of lung cancer in never smokers. There are over 55 epidemiological studies that show that second-hand smoke can cause lung cancer in people who have never smoked. Non-smokers are at risk of lung cancer from exposure to other people's smoke, particularly if they are genetically predisposed or if the exposure is for a long term. So if you have a friend or a partner who is smoking, please advise them to quit. The UK Scientists Committee on Tobacco and Health reported an increased risk of lung cancer in non-smokers, and that risk can go by 20 to 30%. Now, if by chance, if the exposure is high, this risk can double. So, passive smoking can lead to lung cancer too. Studies have also shown that risk for cervical cancer is 73% higher in never smokers exposed to second-hand smoke compared to those who are not exposed. Does second-hand smoke cause any cancer in children? In 2006, the US Surgeon General concluded that the evidence is suggestive but not sufficient to infer a causal relationship between prenatal and postnatal exposure to second-hand smoke and childhood cancer. Researchers also found that children who are exposed to tobacco smoke on daily basis grow up with more than triple the risk of lung cancer later in life compared to those who grow up in smoke-free environment. Furthermore, exposure to tobacco smoke during childhood may lead to head and neck squamous cell carcinoma later in life. Coming to the second factor, alcohol and cancer. Drinking alcohol raises the risk of some cancers. Drinking any kind of alcohol can contribute to 6 kinds of cancers, such as mouth and throat, larynx or voice box, esophagus, food pipe, colon and rectum, liver, and alcohol can increase the incidence of breast cancer in women. Now, what are the guidelines for alcohol consumption? The dietary guidelines of American 2015-2020 recommend that if you drink alcohol at all, drink in moderation. No more than 1 drink a day for women and no more than 2 drinks a day for men. Now, how do we quantify 1 drink, 2 drinks? So, how much does that 1 drink alcohol contains? Now, to quantify that, the dietary guidelines for American 2015-20 shows that 1 alcohol drink equivalent is described as containing 14 grams or 17.7 mils of pure alcohol. Now, there is a reference which tells that 1 alcohol drink is equivalent to how much of alcohol content. Like 354 ml of regular beer will have 5% alcohol. 147 ml of wine will have 12% alcohol. Or 44 ml of 80 proof distilled spirit may have about 40% alcohol. Packed like canned beer, bottled wine, cocktails, it may be a margarita, rum, soda or a sangria, it vary in the alcohol content. Now, for this reason, it is important to determine how many alcohol drink equivalents are in the beverage and the limit intake. All types of alcoholic drinks, including red wine, white wine, beer, cocktail, liquor, are linked to cancer. The more you drink, the higher your cancer risk. Now, to know more about what is the amount of alcohol your drink may have, you would want to visit Center for Disease Control and Prevention and check alcohol and cancer section, which they are beautifully given about the content of alcohol in the drink. Now, drinking alcohol during pregnancy. The recommendation is that if you're pregnant or planning to become pregnant, the safest approach is not to drink alcohol at all to keep the risk of your baby to bear minimum. Drinking in pregnancy can lead to long-term harm to the baby. The more you drink, the greater the risk. Drinking alcohol, especially in the first 3 months of pregnancy, increases the risk of miscarriage or having a low birth weight later at the time of delivery. Drinking heavily throughout pregnancy can cause a serious injury to your baby, and they will be born with a condition called fetal alcoholic syndrome. Here, the baby will have a very poor growth. They will have a very distant facial features and learning and behavioral problems when they grow. We have seen how tobacco and alcohol can cause cancer. Now coming to some tips of preventing cancer. Don't use tobacco. If you're using tobacco in any form, please try to quit. Alcohol in moderation. Don't fool yourself. Be honest. Protect your skin from sun. Wear a good sunscreen lotion when you go out in the sun. Eat a healthy diet. Your plate should be full of colors like that of a rainbow. Maintain a healthy weight and be physically active. Practice safe sex and avoid risky behaviors. Get immunized for HPV and hepatitis. Get yourself regularly a screening test. Both men and women have screening tests. To know more about it, talk to your doctor what are the screening tests available. Remember, there is no denial that all things are possible in life. But don't forget to take care of your health, because without it, too many things would become impossible. If you like this video, give a thumbs up, share it with a friend, and before you go, do subscribe to my channel. And also, I request you to please drop in your comment at the comment box below. Take care and don't forget to enjoy your life. Bye-bye.